So my name is Chris Jones. I'm an orthopedic surgeon here at Hughston Clinic. Dual board certified both in orthopedic surgery and orthopedic surgery sports medicine. I've been doing this formally since 2015. I think I enjoy most about my job, or what's most gratifying, is that we can really help patients' pain and we can do it quickly. Sometimes you see that immediately. A patient comes into my office with a big swollen knee. We take the fluid off, suddenly they feel amazing. And they're like the best friend in the world to you. So I think we do see things, whether it's surgery or non-surgery, where we can almost see instant gratification, where patients are really helped and their pain improves. I think the most memorable surgical cases for me are some of these multi-ligament knee injuries that I see in my practice. So one of my subspecialties is multi-ligament knee reconstruction of a knee, which is a rare branch of orthopedics, and I'm tightly knit with the orthopedic trauma doctors here at Hughston. Where a patient had a bad car injury or a bad motorcycle injury, or even nowadays with how big football players get, a big football or a sports injury where they've torn every ligament in the knee. We have to kind of slowly piece them back together again. And I see quite a few of those in my practice, which has really helped me grow as a surgeon, but it also helps me help a unique patient population here, whereas we don't have to ship them to another city. We can treat them here, which I think is really gratifying. I had one patient who is a collegiate baseball pitcher, came to me with an elbow injury, and I think that he's one individual where I do think we made a big difference in his life because I was able to get him back to playing. He ultimately was drafted and is playing Major League Baseball now, so he's able to both support himself and his family based on a surgery that went well. So I think that's one thing that always kind of stands out, watching him on television. There's a few things I think in the last 20 years that have really advanced orthopedics, especially in what I do in terms of sports medicine. The first one that comes to mind is the use of biologics. So we can use the patient's own body tissues in different ways, whether it's in the form of stem cells or platelet-rich plasma injections, and we can use their own body in a way to help them heal better and recover faster. I think our implants that we use to fix different things, whether it's a tendon repair or a ligament repair or a joint replacement, our implants have come a long way in terms of their design. I think that we can put things now in through much smaller incisions than we used to because the techniques to put these things in are better. And the third thing that comes to mind is the use of robotics, especially in the joint replacement world, and with CT imaging or image-guided joint replacement, I think has really changed the game, and we can often do things now with higher success rates than we could, say, 20 years ago. So I think Hughston Clinic specifically differs from a lot of orthopedic practices because we are a subspecialty group, which means that orthopedics probably has 6 to 7 subspecialties within it, whether it's sports medicine, joint replacement, trauma, hand, upper extremity, spine. And with that, I can send a patient almost the same day to any one of my partners who's more qualified than I am of treating a certain thing. So we can become a one-stop shop for people. In my specific line of work, I really enjoy the work I do with the Hughston orthopedic trauma docs, they're very subspecialized in terms of fracture care, but oftentimes when you have a big multiple injured patient, or you have a bad injury that involves both fracture and ligament injuries, a lot of times we will work hand in hand with each other to make sure the patient's cared for optimally.